I'll make it very short, being the last speaker. Um, First of all, I would like to thank Meera ma'am and Dr. Sanjeev Jain sir for inviting me to this program. As I always point out, like my association started with Nikhil, who was a student, so who thought that they should be all this Huntington disease patients needs to be seen by physiotherapist, because most of the time the falls, even at the very early stage before the fall has occurred. So even we did some studies also on identifying falls in the very early stage. So, but here what I'm going to talk about is, in general, how physiotherapy can help from the mild stage to till the later stage. So, just a brief guidelines which is available by the working group of physiotherapy working group for Huntington disease. So they just put into different, see, we can see it like early stage, middle stage, late stage sort of thing, but then it is very vague when exactly it starts. So if we go with symptom wise the stages, then appropriate intervention can be initiated. So in that sense, so these are the category they have classified so that therapy can be initiated. So I'll go one by one. So generally Huntington patients will have the problem in exercise capacity or the endurance level. So as we all get older and older, our muscle strength also reduces, right? So but then here it is in accelerated manner. So because of that, the one of the other motor symptoms starts occurs. So in order to improve even at the pre-manifested stage, we have to encourage to improve the exercise capacity. It is into two category. One is the aerobic capacity you are going to improve, and the strengthening. So how the aerobic exercise can be given and what dose it can be given. So it can be a simple walking also, but it should be done at least 3 to 5 times in a week, and the duration of about 30 minutes. Okay, so that's the intensity of based on the heart rate. You can around 60% of the heart rate can be targeted for the intervention, for the intensity of the aerobic exercise. Similarly, for strengthening, at least even the major guidelines suggest that at least 2-3 days in a week, 2 or 3 times in a week, strengthening exercise can be done with maximum of 8 to 12 repetitions. This is to maintain the muscle strength and to improve the aerobic capacity. Next. So one of the problem even during Dr. Vikram last talk mentioned about the executive dysfunction, like apraxia and all. So how that can be helped? So in executive dysfunction, what happens is like the person forgets what is first, what is second, what is third. The steps he is going to miss. Simple making coffee, he might instead of first boil the water, he might start putting the sugar, that sort of thing. So probably this can be broken down into steps, so that what is step 1, what is step 2, step 3 can be followed. So that's how even motor actions. So most of the time we have seen the patients, when the simple act of getting up, they just fall. Actually, if you are closely look at it, we can see there are 3 simple steps in standing up for everyone. Even you can also do it now and see. So we take our feet backwards, the trunk forward, and then raise our hip and knee and the trunk. So this is how the standing happens. But this process will be even missed. At that subtle level, this thing can happen. So this can be, it can be actually given an indication like how it can be helped. Yeah, also sensory stimulation in the form of deep tissue resistance, which is believed to be improving the proprioception. Proprioception is something like where do you stand, at what level your joint is there, what range your joint is. So this information is very important to have a good balance. So such informations can be helped by providing the deep tissue resistance And also visual cues, um, like a target on the floor where they are supposed to keep the feet. So at home, probably if a person has to walk from the room to the restroom, this footsteps can be made so that it can be helping the person to walk in a very smooth manner. So even in our study, we found that there is a negative step length happening for the patient. Like they make one step and the second step is not going forward. It is actually overlapping. So when you give a clue like this, visual cue of where the next step has to happen, so person will be able to walk in a very smooth manner because of the vision. Like we have other motor system using a vision, like in Parkinson, how we can use that as a motor generator for walking. So what I mean by chaining is like it's a simple technique. Like instead of you make the person to do a very difficult task, even getting up from a normal chair might be difficult considering the balance issue involved. So if you are going back, for example, you are standing, see for example at this height, if a person is sitting, and standing would not be difficult. This is almost a standing only, but it is sitting. I hope you understand. I can demonstrate that. So that's how we can help of avoiding falls while getting up, even turning around. I think so. Next. And this is we can represent this stage would be around middle stage where the balance problem occurs. So of course balance can be assessed in a simple measures like timed up and go test. You get up from the chair, walk up to 3 meter and come back and sit. If the time is going beyond 12 seconds, we can say the person is at risk of falls. So appropriate measures can be taken. So we should also check the anticipatory as well as the reactive balance. So reactive balance is a person is stepping on an obstacle and how he is balancing himself. Anticipatory is the person knows that there's going to be a destabilizing force. So how I am going to avoid that falls. So also some persons, especially with Parkinson's, they will have a problem in limits of stability because they have the perceived reduced limits of stability. The person thinks that I cannot reach further. I mean, he thinks that he cannot even move a single bit also, that he might fall. So such things, even we can using some sophisticated posturography thing, we can record it, and the training can be initiated to the particular direction where the person is having an issue. And also fall is not something, it's only because of the impairment. It can also happen even for any one of us if our living environment is messy. Like if there is a poor lighting in the room, very unorganized living room, a slippery bathroom, it's for any elders it is a risk. It's the same thing for a person with Huntington disease. So it's not only we improve the impairment aspects, we should also look after this external factors which we can easily prevent. So also we can teach safe fall technique. At any point of time we cannot say that we'll definitely prevent it. In fact it's a controversy thing, like to prevent. Sometimes fall do occur, but we have to make sure that it is not a devastating one. So maybe we can teach a safe fall technique, so person can actually still keep the control and try to sit down. So physiotherapist will teach or demonstrate to the caregiver or the patient. So at this point of time, because of the musculoskeletal involvement, like muscle tightness, contractures develops, so we need to prevent them, but by giving a proper splints and giving a stretching exercise programs. Next. So as the stage, as stage increases, the problem of contracture is a major issue. as I said in the beginning, how strength and aerobic, it has to be as much as possible try to be continued, and the strengthening exercise, flexibility exercises will take care of this problem in deconditioning. Also weight reduction, that because increasing weight or obesity is also additional risk factor for falls, so we need to work on that as well. And Sarah already said pain management. Here it can be a chronic pain, there may be an amplified response also for any small injury, because the person is getting frequent pain and is going to be very hypersensitive about a small simple stimulus, also is going to experience an enormous pain. So that can be given through pain neuroscience education, like how pain is perceived in the brain, how that can be desensitized by our own thought process. And as I already said, the posture is keep on getting worsen, and your a person even sitting in a chair itself is going to be abnormal, like even kyphotic or scoliotic or all sort of abnormal postures can come up. So therapist may work on to improve the posture. Next. So we can say that towards that at that later point of time, respiratory functions is a problem. So most of the time the person's endurance is reduced because of the poor respiratory system. So because that dysfunction happens everywhere, including the respiratory system. So it can be effectively compacted with deep breathing exercises, chest clearance techniques, postural drainage, and things like that. Next. And again, most of the time that happen due to aspiration. So speech therapist already mentioned that the aspiration is a very crucial one. So even with the help of speech therapist and again improving the respiratory care, we can avoid that. So I think also time to time we have to provide a compensatory measures. At the end, what you are going to do is to make the person's quality of life better. So knowing that this condition is not going to get better, no point in keep on giving some very strenuous or high intense exercise to make the person all right. In fact, that actually helps make the person to get worse, because he might fall because of the fatigue. So rather go for compensatory procedures, so that his quality of life is much better. Yeah, with this I would like to conclude. So maybe for further interactions we can have in the question session. Thank you.